Now, more teens are turning to weight loss drugs to treat obesity. Specialists say that meds like Wegovy, along with a healthy lifestyle, can be used to tackle excess weight before it leads to other health conditions like diabetes, heart disease, and even high blood pressure. Now, the American Academy of Pediatrics is recommending weight loss drugs be offered to those as young as 12 years old. So this morning, we have our 9 News medical expert, Dr. Payal Kohli, here to talk a little bit more about teens using these types of medications. Dr. Kohli, good morning. Thank you for being with us.
Thanks for coming in. Yes.
Well, we know that weight loss medications have been widely used in adults. Now we're seeing it used with kids as well. What is your take on this?
It's been incredible. We've had 14.4 million adolescents and kids who are affected by obesity. And up until now, it was just the stigma, this weight that they carried around on their shoulders, where we said, do more exercise, eat a better diet, and it's on them to get it off. And now for the first time, this is one of many medications actually approved for kids and adolescents that can actually get the weight off in a very healthy fashion. So this was studied in a New England Journal of Medicine study that really made a lot of waves because it's the first time we're shifting the needle and putting a medicine in our kids. And to give our kids a medicine, you have to have a pretty high threshold for safety and for efficacy. It has to work and it has to be safe. And in fact, what the trial showed is not only did they lose more weight than adults did on the same medication, their hemoglobin A1C, which is their blood sugar, their liver tests, their blood pressure, their waist circumference, everything got a lot better.
What are the risks of doing this?
Well, and that's the thing. That's what this trial showed, that it's no such thing as a free lunch. In fact, there were about 11% of kids that had serious adverse events during the trial, so 1 out of 10 kids. And remember, we're talking about kids that got into the trial with clinically severe obesity. So that's greater than 95th percentile for their age. So we're not talking about kids that may have a little extra weight. We're talking about kids whose obesity is kind of causing them problems. We also saw gallstones. We saw more gastrointestinal side effects, which we see in adults as well because of the way that the medication works. But overall, very safe, no surprises. But again, along with the weight loss came the gallstones and came some of the other adverse effects.
Okay, gotcha. I was just going to ask you what those adverse effects were. Who exactly along those lines would you warn not to be using this?
Yeah, so this is the challenge. As we start to put obesity medications out there, people's self-impression of obesity starts to guide their behavior. So clinical obesity is greater than 95th percentile for your age, or if you're 85th percentile and have weight-related conditions like sleep apnea as a child, that's a marker that it's affecting your health. This is not for the child that wants to drop a few extra pounds for spring break or the adolescent that wants to get into a prom dress or what have you, because if you start this medicine and then stop it, you're likely to gain the weight back. The medicine is not for recreational use, in fact, has a lot of side effects as we just discussed. And if you go to a med spa and get this medicine, that's not even the right medicine. Those compounded medicines that are available out there, these aren't the ones that have been clinically studied for safety and efficacy. So we have to be really careful that this doesn't just become some trendy thing to do, where we just kind of use it as a beauty treatment, because it's actually a medical intervention.
Well, I think part of it too is, again, we have to talk about like learning how to eat properly and exercise properly, not a magic pill. Like, it makes sense for certain groups to have this, even in adults, right? But at the same time, it's like, we don't want to get away from the things that do make us healthy in the first place naturally.
And that's so true. In fact, the American Academy of Pediatrics in their guidelines says the first line is always lifestyle changes and diet, because teaching us how to eat the right types of foods, that's going to sustain the weight loss, not necessarily the medication. Now, for people who aren't able to get to their healthy weight with those interventions, then you might want to think about not just these types of medicines, but even bariatric surgery or weight loss surgery for kids. That's also endorsed by the American Academy of Pediatrics. But we cannot put the horse, the cart before the horse and get to a medicine as a shortcut, because teaching them the right behaviors is going to help them have a much healthier, longer life.
Yep, sustainable healthy diet, sustainable exercise regimen, and I know we struggle with this, but good sleep as well.
Yeah,
for sure.
So hard. Dr. Kohli, thank you.
A reminder, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Now,